Hello everyone, in this video, we'll discuss pleomorphic adenoma, the most common benign tumor of the salivary glands. We'll go through its definition, clinical features, histology, and treatment, and now the AI version of Dr. Nathir Al-Rawi will carry on.
Imagine you're in a clinic and a 40-year-old woman walks in with a visible swelling below and in front her ear. She tells you that the swelling has been there for several years. She has no history of trauma, fever, or pain, and there are no significant past or present medical issues. Naturally, you would order an ultrasound and a fine needle aspiration, cytology, to investigate further. Fortunately, the results indicate a benign tumor. So, what do you think this tumor could be? Yes, this is pleomorphic adenoma.
Pleomorphic adenoma is a benign tumor of the salivary glands. It consists of epithelial and mesenchymal components, including chondroid, myxoid, and osseous tissues. It originates from the intercalated ducts and myoepithelial cells. Although it was previously called a mixed tumor, we now know that it arises purely from epithelial origin, single germ cell layer, which is ectoderm, despite having stromal and epithelial components. When discussing pleomorphic adenoma, it's important to note its key clinical features. First, the most commonly affected gland is the parotid. However, this tumor can also appear in the minor salivary glands. The most common site of occurrence in the oral cavity is the palate, followed by the upper lip and buccal mucosa. Additionally, pleomorphic adenoma shows a clear female predilection, and it typically presents in patients middle-aged and elderly between the 4th to 6th decade. Clinically, the tumor is characterized by a painless, slow-growing swelling. These features are essential in guiding your diagnosis and treatment plan. In gross pathological view, pleomorphic adenoma is characterized by being well demarcated, yet having an incomplete fibrous capsule. This incomplete encapsulation can contribute to recurrence if the tumor is not entirely removed during surgery. Upon cutting the tumor, the surface appears rubbery, fleshy, and glistening due to the presence of a chondromyxoid matrix. The overall color of the tumor typically ranges from tan to white.
Let's take a closer look under the microscope. In pleomorphic adenoma, you can identify two main cellular components. First, there are the epithelial cells. These cells proliferate to form tubules or duct-like structures, with the lumens typically filled with eosinophilic material. Second, we have the myoepithelial cells. These cells either surround the ducts or appear as isolated cells, and they show varied morphologies, ranging from angular to spindle-shaped or even plasmacytoid.
In addition to these epithelial components, the tumor also displays a mesenchymal component. This is seen as loose myxoid tissue, along with areas that are chondroid, osseous, and even hyalinized. Together, these features give pleomorphic adenoma its unique, mixed appearance. Pleomorphic adenoma can be classified based on its histological composition. Some tumors are stroma-rich, containing a low epithelial component, while others are stroma-poor, with a predominance of epithelial cells. Importantly, stroma-rich tumors have a higher recurrence rate, and although malignant transformation is rare overall, it is more likely in these stroma-poor variants. With access to microscopes, we can observe that the capsule is often poorly formed. In many histological images, normal salivary gland tissue is still visible in the above arrow. Additionally, there is often a mild chronic inflammatory infiltrate in the surrounding salivary gland tissue, while the tumor lies just beneath the capsule. In this higher magnification histological slide, you can see that the tumor is composed of both epithelial and stromal components. The epithelial cells form distinct structures, while the bluish material represents the chondromyxoid stroma. Additionally, we can also see the capsule. In this higher magnification histological slide, the epithelial components are basically the lining of the ductal epithelial cells, whereas the myoepithelial component sprinkled in the stroma, and this stromal cells are all derivatives of myoepithelial cells. Good morning. This is myoepithelial cells which differentiate into these stromal components, Finally, the stromal component, which are, again, derivative of the myoepithelial cells. Predominantly, it will be chondromyxoid The treatment of choice is surgical excision. When pleomorphic adenoma occurs in the superficial lobe of the parotid gland, superficial parotidectomy can be done. When the deep lobe of the parotid is involved, total parotidectomy with preservation of the facial nerve is the choice of treatment. Complete removal of the submandibular gland is mandated if it is involved. For pleomorphic adenoma occurring in the minor salivary glands on the palate, it is essential to remove the tumor along with the periosteum. With proper surgical removal, the prognosis is excellent. In conclusion, pleomorphic adenoma is the most common benign salivary gland tumor, typically presenting as a slow-growing, painless swelling. Proper surgical excision ensures a good prognosis. Thank you for watching. If you have any questions, feel free to ask. And here are our references.